My name is Dr. Corey King, DC, and I'm the owner of the Tustin Chronic Condition Center. I specialize in working with patients that are suffering from diabetes. Whether you're a type 1 diabetic or you're suffering from type 2 diabetes, insulin resistance, I can help change your life. Now, I'm the only doctor that's in the Tustin region that's using both neurological and metabolic therapies in order to add value to our patients' lives. My number one goal is to improve the quality of every single patient's life that walks in my front door. That is why I'm here, and that is why I love doing what I do. I've had family members affected with diabetes, so I have a first-hand account with this deadly disease, and this disease is not getting better. This disease is actually getting worse in our country, and we go over that at our diabetic workshop. Now, let's talk with you how we approach our diabetic patients. If you're a type 1 diabetic, you have an autoimmune condition. We're not dealing with diabetes. We're dealing with an autoimmune attack onto your pancreas. We must find out why your body is attacking your organ. Your body isn't specifically only going to go after your pancreas. It's going to go after joints, which is rheumatoid arthritis. It's going to go after nerves, which is multiple sclerosis. It's going to go after your gut, which is celiac and Crohn's disease. It's going to destroy the nerves in your feet, which is peripheral neuropathy. If you have type 1 diabetes, we must be managing your condition from an immune system perspective, and we teach all of this at our diabetic workshops. We must run the appropriate testing to figure out what in the world is causing your body to attack your organs. We do that by running stool tests looking for parasites, bacteriums, molds, and yeast. We're running full blood panels, so we're looking to see if you have an anemia. Of course, you already have a blood sugar issue. We need to evaluate your liver, your gallbladder, and your intestinal system. We do that through a basic blood test. We also run what's called an immune panel. We are looking at what's called your T and B cells of your immune system. Those are the cells that help to fight your war. We're also looking at the helper cells and the suppressor cells and your natural killer cells. I know that might be a lot of just medical terminology for you, but just understand, if your doctors are not running immune panels on you, they have no idea what your immune system is doing, and they're missing pieces of your health puzzle, which is why you haven't gotten better. We also look at your adrenal glands. Those help to regulate your blood sugar. So on top of having a type 1 diabetes, you are also having adrenal gland dysfunction, and if your adrenals can't regulate blood sugar, you're not going to sleep well at night, you're going to be waking up. That's called insomnia. And no matter what you do, your blood sugar seems to do this, no matter if you're eating a great diet and living a healthy lifestyle. So for our type 1 diabetics, we've got to be running the right testing. We also work with you from a neurological perspective as well, because your disease destroys your brain. That's called brain degeneration. You see brain degeneration in dementia, Parkinson's, and Alzheimer's. We are literally able to reverse those diseases by strengthening your brain, and we do that through non-invasive neurological treatments. How do we know what to do? We've got to test you neurologically. We do a head-to-toe neurological examination to determine if your brain has been affected or not. Think of your body like this. It's a car. Your blood is your oil. Your brain is your motor. If your oil is bad long enough, what happens to your motor? Exactly. Your motor starts to break down. That is called brain degeneration. It's the best analogy that I can use. So we do all these therapies in our office. Now, most of our diabetics are starting to lose the sensation into their feet. That's called peripheral neuropathy. Diabetes is the leading cause of amputations of our limbs. So if you're losing sensation in your feet, and if you're like a lot of our patients, you don't even realize it yet until we test you, that is your body destroying your feet. If you can't feel your feet cannot relay neurological impulses back to your brain, and your brain's going to deteriorate quicker. Are you starting to walk into rooms and forgetting why? Are you misplacing your keys? You can't seem to find your keys. Are you forgetting names and phone numbers, forgetting words mid-sentence? These are early signs that your brain is starting to deteriorate. Our type 2 diabetics, 20% of you are autoimmune as well. This is on the rise. We must be checking what's called GAD antibodies to determine if your diabetic condition is caused by an autoimmune attack. An autoimmune attack is like a big raging forest fire. If you pour the gasoline onto your fire, what's going to happen? Exactly. It's going to keep destroying what's in its path. That's what happens in our type 1 diabetics, and for 20% of our type 2, it's happening in you as well. For the other 80%, unfortunately, you've brought this upon yourself through diet and lifestyle. We must we must manage your condition from a dietary and lifestyle perspective. Now, you're insulin resistant. Your cells are shutting down to insulin. They're saying no more. We've got to allow those cells, it's basically like little doors. Insulin is what opens the doors to bring the glucose in, which is your blood sugar. We've got to give you natural support to allow those doors to open back up. Think of it like changing a lock. You bombard your body for so many years with insulin, the locks shut down and they say no more. Insulin builds up in your bloodstream just like your blood sugar does. Now your blood sugar is high. Insulin gets converted to your triglycerides, your lipids, so your cholesterol is getting high. Now they've got you on medication for cholesterol, a statin, or they're putting you on blood pressure medications because your blood pressure is getting elevated because your arteries are getting clogged. And this is a disease that's the #1 cause of kidney failure in the United States, and it's the #1 cause of blindness in the United States. Where do you picture yourself in the next 2 to 3 years if your condition's not gotten improved? In the next 10 to 15 years, where do you picture yourself? If you're like most of our patients, having a heart attack or a stroke concerns you a little bit. But if you develop dementia, Alzheimer's, or Parkinson's, now your family members are having to take care of you as they're watching your life wither away. Have you already been threatened with having your limbs amputated? That is a big motivating factor for the majority of our patients. If you do not want to end up in a wheelchair, you must get your disease under control because it's going to chronically degenerate your body. It does not get better. So what I'm going to ask of you is you input your information below. You're going to request your 2 special visits with myself, and we're going to give you a special rate for that, and we'll explain that when you call into the office. We're going to schedule your first visit. We're going to be going go over all your paperwork. We're going to go over your past laboratory tests, and we're going to be doing neurological testing on that day. Your second visit is when I'm going to sit down with you. I'm going to explain to you, if I feel I can help you, I'm going to accept you into our program. Our program is very limited. I limit it to those who are motivated to have their condition changed. If you're not motivated, if you want a quick fix, this is not the program for you. But if you're willing to do whatever it's going to take, this is going to be the right place. Because this disease does not get better on its own. It only gets worse. If you keep doing what you've been doing, you're going to keep getting what you've got. I'll repeat that again. If you keep doing what you've been doing, you're going to keep getting what you've got. Now, I'm from the South, so that's how we speak in the South. I'm from South Carolina. So input your information below, click send. A staff member or myself will call you within 48 hours. I personally like to call you and ask you a few questions about your condition just to make sure this is going to be the right thing for you and I to do as far as sitting down and having an in-office consultation. Again, my name is Dr. Corey King. I'm the owner here at the Tustin Chronic Condition Center. I specialize in working with patients with diabetes, and I look forward to adding value to your life.